Can you see it? Okay. Oh yeah, I forgot about that fancy thing. So I've been doing motivational interviewing since about 1997 with a whole bunch of different populations, ages of people, which is one of the really nice things about MI is that it's applicable and there's evidence to support it's effective across all kinds of different health behaviors, everything from flossing teeth to increasing physical activity. And then also shown to be effective across different populations. So across racial groups in the United States, there's research to demonstrate its effectiveness across 6 continents of the world, not Antarctica. And then also across other types of populations like children, adolescents, older adults, the elderly. So it's a pretty transferable type of a skill. And what I'd like to do is first off, I know that we have a case, so I want to be quick with it. Would somebody be willing to play a patient or even yourself about some kind of health behavior that you're a little bit ambivalent about? And I'm kind of going to try and do like a little MI intervention on steroids. You know, I wouldn't really usually work quite this fast or furious, but, you know, just to kind of give you a sense of some of the things that I would be doing. So would somebody be willing to play a client or even yourself and just discuss a little bit about a health behavior that you're kind of on the fence about? Like maybe you know that you should be running or exercising more, but yet, you know, the couch looks really nice when you get home, that kind of ambivalence. Anybody open to that? Going once. I could do it myself, but that would be really weird. I could play both people. I can definitely do that.
I'll do it.
Oh, thank you, Dr. Smith. So, Doug, what brings you here today?
Well, you know, over COVID, I lost weight for a while actually, and then I gained it back and probably lost 11 pounds and gained back 8. Kind of frustrated by that. And on the other hand, the only time I seem to exercise is on the weekends, borrowing energy from my wife, who actually exercises 7 days a week.
Wow.
Way too early for me to get involved in the weekdays. So I know I should do more, and actually I think I was doing more during some of COVID, which is probably why I lost some weight. I don't think my diet's changed much, although that probably should also change. So, you know, yeah, I'm pretty ambivalent about it. And yeah, certainly I'd like to look better in my string bikini this summer. So
nice. Well, we all want that, Dr. Smith. So first of all, you know, good for you. Like, it sounds like overall you still are basically down 3 pounds. How were you able to make progress over COVID? What was working for you at that time?
You know, I think I had actually more control over my daily routine, as much as it seemed like I was more back to back with meetings, that I seemed to have more control over eating habits, even though there's certainly more snack food here than there was at the ADM board. I was working usually at the ADM board 2 days a week and at home the other 3. That's how we did all our staff. And so I think it was that. And there was a period of time when I was doing more early in that, more work at Neomed, and I actually had joined the gym there. So I was doing that a couple times during the middle of the week. I'm motivated by the fact that I was paying for it. So I suppose that was helpful, and yet and I could do that when my day ended before I left, but at home, paraphrasing you, you know, the couch, or at least my desk chair, looks more appealing at, you know, 6:30 at night than the treadmill downstairs.
Yeah, I think that makes sense. It sounds like it's sort of accessibility and structure. Those were 2 of the things that were working for you, is that, you know, there wasn't as much snack food accessible. The gym was more accessible, and to some degree you kind of had more control over your living situation and your space and such. And you had mentioned that, you know, you're mentioning kind of 2 things like that obviously can help weight: physical activity and what you're eating. Which one of those things do you really want to kind of focus on, or would you rather focus on both?
Oh, that's a good question. I think I'm back to focusing more on my eating habits a little bit better. So probably trying to figure out how to exercise more. Even if I could get in one time in the middle of the week, it would probably be, you know, maybe that would be 5 of the 8 pounds. You know, it probably wouldn't be all 8, but I think that's just seems, I'll make plans. I'll think about it. Okay, I'm going to do, as an example, Memorial Day weekend, 3 days in a row. I exercised all 3 days.
Well,
And the net result at the end of that week was I lost a pound.
wow.
So clearly there's some correlation there. But I doubt when I step on the scale tomorrow, I usually weigh myself on Saturdays,
Mm.
that I will have continued that loss.
Okay. Okay. So what do you kind of mentioned this, that you kind of had this debate with yourself, or so to speak. How do you talk yourself out of exercising? Like what are some of the things that get in your way of exercising?
Well, at the moment, the days I'm basically responsible for making sure my sons are home from college, making sure dinner is ready. Although my wife, in her defense, often has it relatively pre-prepared, but still. So I get done with the work day, I'm getting the dinner ready, and by the time all that happens, there's probably an hour in there that I could maybe exercise, but I just keep doing other things work related or surfing the web. And then my wife gets home and we do take a walk. So I do walk every evening. So I'm
That's
getting
great.
that version of exercise, but I'm not doing the tread. We have a treadmill and a recumbent bike. I'm not doing either of those
Mhm.
that I would do on the weekend.
Gotcha. Well, I want to say it sounds like your family is really important to you, and making sure that you're pulling your weight in your family is important, and that's part of what gets in your way, and that's really understandable. It says a lot about you, and it's really nice that you still find time to walk with your wife. What are some of the things what are some of the reasons that why you would want to, aside from the stream bikini, what are some of the reasons why you would want to increase your physical activity? What do you think the benefits would be?
Oh, my guess is overall more energy, and of course, I'm not getting any younger. So if I could come up with a better routine instead of twice a week, which is generally the weekends, 3, ideally 4 times a week, I imagine that would help me over the next 30 years. That would be a beneficial thing, and actually, even to the extent that the walking has probably helped some. Um, it seems like I probably need to amp that up a little bit with something. And I think, so the benefit of the gym was that I had resistance machines there. I really didn't do aerobic there. I did a resistance. That's harder to do at home.
Mm,
So I've got a couple of dumbbell weights, but it's just not the same as getting on a machine. You can easily adjust the pin and
mm,
change the weights, which I did improve in my
mm.
6 months or so doing that.
Nice.
Um, Reminded me of being in late college when I actually joined a gym for about 2 years, and probably looked the best I've ever looked at that point. Unfortunately, I still did not wear a string bikini then, but
Mm, mm,
uh,
mm. How, how did you feel like when you noticed your body changing, and you noticed like the benefits of lifting weights? What was, how did you experience that? What was that like?
I think overall it was positive. It was not difficult to stop at the gym because
Mhm,
it was at the entrance of the building and I could just plan for it and pop in and do my thing. My routine probably took 45 minutes, which is not
mm,
bad. I did most of the machines as high as the reps would go. Um, Kept eyeing the rock climbing wall, but never quite got to that. Although
mm,
I've done that other places, but um, so there was something about just the convenience of it, and then I could get home and still attend to the family and so forth. Whereas if I'm at home already
mhm,
and not leaving Neomed normally at this point in the evening, there's no easy gym.
mhm,
Despite the fact that I work in the public health building, we don't have that type of health.
gotcha. So yeah, I mean, it sounds like kind of the dilemma obviously is that you're busy. You want to contribute when you get home. You want to participate and get meals together, and at the same time, and also you want to have a little bit of your own time, like that hour where you just kind of like, just kind of do your thing. And on the other side, you see this real benefit to exercising. The next 30 years, you want to continue to feel healthier. You want to continue to just kind of have these activities and look at yourself and like what you see. What do you think would be a next step for you? Like what's like kind of the logical next step?
Well, logically, I would make a more definitive plan to at least add probably a Tuesday, Wednesday, or Thursday, since that would give me a break Monday or Friday from having exercised before or right after that, and actually doing the exercise, even if I targeted 30 minutes on the treadmill or the bike, I think I'd feel once I accomplish that enough weeks in a row, I'd hope to make it a habit.
That sounds like a great idea. So I like how you're also talking about like progressing, right? So you're talking about picking one day, one additional day in 30 minutes, and then kind of seeing what happens.
I think that's doable. It just, when I get to the Tuesday, Wednesday, Thursday evening, it never seems to happen.
So if you were thinking about next week, which day of the week would you want to pick? Tuesday, Wednesday, or Thursday?
It would probably be Wednesday, because Thursday we have a board meeting for our ADM board of trustees. So probably Thursday.
Okay, so Thursday.
Wednesday rather.
Or Wednesday.
Wednesday. Yeah.
So what do you think, knowing yourself, what do you think makes it most likely that you would actually get that 30 minutes in on Wednesday?
That's a great question. That's what I have to figure out, I guess. what the momentary motivator is as opposed to the long-term motivator.
Would it be okay if I share an idea with you? Take it or leave it?
Sure.
Okay. Well, sometimes people find that if they enlist their family, that can be really helpful. And it sounds like your family is really important to you. And that's part of the thing that makes it challenging. So sometimes people benefit by talking to their family about their plan and kind of asking for their help and their encouragement. I don't know if that would be something you'd be into, but what do you think about that idea? I guess about being transparent with your family about your goal for Wednesday night.
Yeah, that's a good idea. In fact, if my one of my sons, and they do sometimes go down and exercise, they don't need to as much as I do, but you're right. That's a good thought. I tend to get motivation running or biking alongside my wife on the weekends. Maybe I could get one of them to do a machine on Wednesday, and I could do it next to that. Okay. I like that idea.
Oh, that's great. That's a great idea, because that also gives you, I hadn't even thought about that. The way you're thinking about it even gives you time with your son or sons, and you're also getting that physical activity in.
Right.
Okay, well, let's if it's okay with you, let's check back in a week or so and see how things are going.
All right, very good. Thank you, Doctor.
All right, well, thank you, Doctor. All right. So I'll kind of go through, did I love what I did? No, but that's why, there's some things I was like, I shouldn't have done that or whatever. But I'll kind of go through, I'll go through what the encounter we had via this PowerPoint, to kind of highlight some things I was trying to do. So what, we're just trying to, essentially the objectives, understand some motivational techniques within MI that can help improve outcomes. Look at some of the relational and technical dimensions underlying the motivational techniques, and then look at some specific skills to evoke change talk, which I tried to do a couple of those. So what's the definition? A collaborative conversation style for strengthening a person's own motivation and commitment to change. That's really the important thing. When you're thinking about MI, you're trying to get the person to talk themselves into change. You're trying to think of how to do that. So, for example, when I was asking him how he felt about himself when he had been lifting weights regularly, that's kind of what I was trying to pull for, because oftentimes when people are have a period of time where they're more physically active, most people feel better. They feel more energetic, which is why I was trying to encourage him to speak out, like what were the benefits of having worked out regularly at that point in time, so that he would hear himself talk about the benefits. And then at the end, arranging conversations so people talk themselves and change based on their own values and interests. It became clear to me early on that Doug cares about his family, and a part of what gets in his way of exercising is that he wants to contribute to the family. So when you're an MI, you want to highlight that, right? Because being family oriented is healthy. And at the same time, so you want to kind of affirm that in the person's, value in family. And at the same time, acknowledge that it can be, challenging in terms of meeting some of these demands. And at the end, when I realized that his idea kind of brought those two things together, I really tried to highlight that his plan that he wound it up on was he and his son might exercise together, which kind of gets that family connection thing together, and it also increases his physical activity. And that's typically what you're trying to do. You're trying to help someone better align their values and goals with their behaviors. The MI spirit kind of has four main dimensions. So there's partnership and collaboration. Essentially, the idea is that Doug or any other patient who's in front of me knows a lot about themselves that I don't know. Obviously, I have expertise too, which is why I asked him things like, what do you think could help you get started? He didn't know, right? He didn't have a great idea. But I'm still in the MI world, I'm typically going to ask my patient first, what ideas do you have to make this work? Because sometimes they have brilliant ideas, things I could never come up with. Sometimes they don't know, right? And then I asked, if you noticed, I asked him permission to bring up an idea I had. That's a real MI collaborative intervention as well. We just don't, in the MI world, we just don't spout off about things that we think patients want to hear. We wonder whether they want to hear it first. And then if they say yes, then we educate, and then we wonder what they think about it. So we don't leave patients nodding at us, right? Like, yeah, oh yeah, exercise, right, all over it, doc, right? Like, because people nod their heads and it doesn't really mean that they're going to do what we're talking about. So we circle back in MI after educating and say, what do you think about that? Or how does that fit into your life? Or would you imagine yourself doing that, right? So that's what I was trying to do in terms of asking his ideas. He didn't have any. Then I asked permission to give him one of my ideas and then wondered what he thought about it. And that also gives him the opportunity to say, hey, I don't really like that idea, but here's another way I could think about that, right? And then the second part of the MI spirit is acceptance. And acceptance, because academics come up with this stuff, is comprised of 4 things. Everything's always got to have multiple factors. So it's accurate empathy, and really around the accurate empathy, you hopefully noticed that, or hopefully I did it. I was trying to ask him a lot of questions that got him talking, and then I was trying to give him reflections back, like saying statements to him sort of about what he had said to make sure we're on the same page. I also, if you noticed, I was very intentional about figuring out, did he want to focus on physical activity or diet? And when he mentioned physical activity, I asked him, what are the things that get in his way? And in MI, that's almost always where you start. You wonder why the person's engaging in behaviors that we perceive as unhealthy. And we start from that place and we empathize with it. Oh, I get it. You're really busy and you care about your family and they're a priority. So not only do you ask, what do you like about smoking? What do you like about drinking? What do you like about not taking medications? What do you like about cutting yourself? Whatever it is, or what do you get out of it? You also empathize with it. And then I did on the reverse side say, well, what if any benefits do you think there could be to increased physical activity? So you're typically starting with why do they like the unhealthy behavior, and then you end on why they like the healthy behavior. That does a lot to build rapport with people. It also demonstrates that they have absolute worth, right? People do things for a reason. I haven't met anybody yet who didn't do something for some reason. The reason may not make sense to me, but it makes sense to them. Right. And it's just acknowledging that people are ultimately good. This is based on sort of a humanistic philosophy, MI is, and that suggests that people are generally good. People generally want to be healthier. People generally want to get better. Just sometimes we get stuck. And emphasizing autonomy is really just acknowledging the person ultimately makes the decisions. We don't fix anybody. And even I do this, meet with a lot of surgeons. Surgeons don't even fix people. And they'll tell you that as well, because they might fix the thing in the moment, but let's just say like the Cleveland Clinic and heart disease, the person still has to leave and not go back to smoking and drinking and all that kind of stuff, right? So people ultimately, to some degree, have to fix themselves. And then affirmations. If you notice, there's a few times which I tried to really whoa, well, that was a net 3-pound loss. And that's really great that you walk with your wife. And, and really acknowledging people's successes, even if they're a little smaller, because that helps build people's confidence. Compassion, basically just stick to your ethical codes. People have used MI for things like getting people into research projects, encouraging people to engage in services they don't necessarily need. So, basically, as long as we all stick to our own fields, ethical codes, we're good on that. And evocation is trying to figure out ways to get the person to talk themselves into change, right? So again, an example of that was, how did you feel when you're exercising regularly? If I'd had a little bit more time, he was talking about in 30 years, I would have wondered, well, how do you want your health to be in 30 years? And what what's important about that, and what would it be like for you and your wife to be able to have a really like active retirement, right? Because ultimately, nobody wants to lose weight. Nobody wants to exercise or eat healthy. People want to exercise and eat healthy because there's a benefit. So we need to get them to talk about how those behaviors link to what they care about, right? It's like the pot of gold at the end of the rainbow. The rainbow is really hard to get through, so we want them to keep thinking about the pot of gold that's going to be there. These are some things that if you're doing, does this mean that I never do these things? No. But in general, if I'm doing MI, and in general, the way I work with patients is I try not to do these things. So persuading without permission, that would have been if I'd have been like, hey, Doug, I got a great idea. What you need to do is talk to your family and get them on board with your plan. And then Doug would have probably been like a normal patient, would have nodded at me and thought, I'm not going to do that, but I'll nod at you anyways. So it's, what I did was gave him an idea with permission. Is it okay if I tell you an idea I have? What do you think about that? Confronting people. I mean, people who are a lot more important to our patients than us confront them all the time, and that hasn't helped. So I don't know that's going to help if we do it. Having a premature focus, I asked him specifically, do you want to deal with physical activity or diet? If I'd have been stuck on diet and he'd have been stuck on physical activity, I would have had a premature focus, right? Like I would have been like, that not where he was. Labeling people. I always like to joke when I was I'm in long-term recovery, and when I was in drug treatment, my diagnosis was polysubstance dependence. And for whatever reason, every clinician I ever dealt with needed me to own that I had polysubstance dependence. If you have kept up with the DSM-5, you will have learned that label went away. So why in the heck was it so important for me to identify with this label that doesn't even exist anymore? And my point of that is science continues to evolve, right? So do we really need, yes, we need labels in terms of diagnosis for billing and coding, but do we really need the patient to own? I'm going to argue that we don't. Blaming and shaming, again, people who are a lot more important to our patients do that with them all the time. If their mother couldn't blame them and shame them into changing, I don't think I can. And then educating without listening. People really do not like being told what to do when they believe the person doesn't understand them very well yet, right? So what are the skills? These are the most simple skills in the world. The hard part is figuring out how to use them. Open-ended questions, or just a really good example of open-ended questions is the end of an encounter. We oftentimes ask people, do you have any other questions? And they typically say no. And what we know is that a lot of patients, research suggests a lot of patients leave encounters and did have other questions, right? But our yes/no question wasn't particularly inviting. So maybe a course correction could be, what other questions do you have? There's an implied message there that you probably have some. And you know what? If they don't, that's fine. If they do, it might have made it easier for them to say, hey, I got one other question about that thing you talked about. Affirmations, again, especially in certain fields, I've cut my teeth in drug treatment field. Unfortunately, we're always trying to catch patients doing stuff that's, like quote unquote unhealthy. This is the reverse of that. It's really trying to catch people being healthy, right? And acknowledging that. Reflective listening are these statements that you make that are empathic toward a person. So I can't remember with Doug, I know I did some, I know I didn't love them, but you try and also say it in a different way, like not parroting somebody. So, maybe when he's talking about the bikini body, a good reflection would have been, aside from just joking around, saying like, the way you look is really important to you, or, something like that, saying something like a statement that's getting at what he's saying, but differently, right? A summary is a long reflection. And I didn't do this intentionally just because of time, but that a real summary would have been, okay, Doug, so on the one side, you're not exercising because like you're really busy and you don't have a lot of time in the day. And a lot of that day is occupied by working in family obligations. On the other hand, you do want to engage in physical activity because of how you're going to feel and this 30-year plan you have. So you're kind of like summarizing what are the reasons why that you don't want to change and one of the reasons why you do. Informing with permission is what y'all saw me do. Would it be okay if I share with you an idea I have? You can do that with lots of things. Would it be okay if I share with you what I think is going on with you? Would it be okay if I share with you what your prognosis is? You know, all that kind of stuff. And then you are asking what you think about that. So it's kind of a sandwich. Can I share with you? And then what did you think about it? And lastly, these are 9 specific strategies to get people to talk themselves more into change. Evocative questions are asking about desire. Why would you want to increase your physical activity? Ability. Why, if you were to increase your physical activity, how would you do it? Reason. Give me one good reason to increase your physical activity. Need. How come that's important? The acronym is DARN. Desire, ability, reason, need. There's different ways of asking about motivation. Elaboration is getting people to, like, you know, a lot of times people say things like, well, how did you feel when you used to work out? And they say, oh, I felt really good. And I'll say, well, tell me more about good. And that's when you hear, oh, I was like way more laser focused at work and I liked my body more and I felt more confident and I was sleeping better. That's the magic, right? Good. But when they elaborate on good and tell you all that, that's them talking themselves into change. Examples is kind of similar. And I kind of asked this in a different way, but I was basically like, what were you doing that was working with you, for you, you know, over the pandemic? Kind of, you know, another way of saying, give me an example of when this was working for you. Decisional balance, pros and cons, already mentioned that. Again, you're asking first off, why do you like the unhealthy behavior? I mean, you don't ask it like that, but you know, whatever the unhealthy behavior is, you're wondering what they like about it. And then you're flipping it to what don't they like about it. Looking back, sometimes you might do that when you're asking people to think about times that they felt like they were more successful. I did that with Doug because he said that he had made good progress over the pandemic. So what was working back then, right? What was different back then? Looking forward, I ask questions like this in drug treatment all the time. If our work together went pretty well, what would be different 3 months from now? And that's when people tell you things like, well, I'd have custody of my kids again, and my mom would trust me and be able to sleep better at night, and I would be off probation. And then, you know, then you realize, okay, those things are important. Mom, getting off probation, kids, and whatever they're doing, I will kind of wonder, well, how is what you're doing right now helping you get those goals, helping you put your mom at ease, right? Asking about extremes. So, you know, with Doug, I could have asked him, what's the best thing that happens if you stick to your plan and start working out on Wednesday? And then I could say, what's the worst thing that happens if you continue not to work out these extra days a week? Importance and confidence rulers. So people who study motivation believe it's comprised of importance and confidence. So if I am going to stop drinking Monster energy drinks, which there's still a bugaboo. I'm much better with them, but still a little bit of a bugaboo. It's got to be important for me. I got to believe there's an important benefit that I'm going to get from stopping drinking Monster energy drinks. And I also have to be confident. I have to be confident that I feel like I'm going to be activated and stimulated without Monster energy drink, and that I can do it, right? Just confident that I can do it. And if I'm short in either area, I'm probably not going to stop drinking Monster energy drinks. And you all have had patients, I'm sure, who said things like, I can stop smoking whenever I want to. I just don't want to because everybody in my family smokes and we don't seem to have any problems with it. They're telling you they're highly confident. They don't think it's important, right? Their family somehow is immune to nicotine or to inhalation of tobacco. Versus you have other people who say, I know smoking is killing me. I know I can't stand how I smell. I'm hacking all over the place. I'm spending all kinds of money, but I can't do it. I've tried 15 different times and I can't do it. They're very opposite. They're telling you it's important. They know it's important. They just are not confident. And it's really important that you know where somebody's stuck because interventions are different. Obviously, if you're trying to help someone see it's important, that's going to be different than helping to boost someone's confidence. And sometimes just exploring goals and values in and of itself. So, you know, even like thinking about it now with Doug, I may have asked him, you know, knowing that he cares about family, I may have asked him something like, you know, what do you think it'd be like for your sons to notice you increasing your physical activity? How do you think that might shape their future, right? And that might tap that part of him that's like, yeah, I am a role model, and that would be maybe inspiring for them. And that might be increasingly motivating for him, right? Because it's in line with his values of being family oriented and it dovetails with physical activity. Those are a bunch of references. One thing I would say, shoot, I thought I had this on here. Well, it's easy enough to remember. www.motivationalinterviewing.org. So www.motivationalinterviewing.org. And motivational interviewing is one word in that. There's tons of free resources on there, as well as videos where you can watch different types of clinicians and different types of encounters doing MI with really bad actors. So if you like bad acting and you're interested in MI, that is your site. All right, y'all. Thank you.